yourself to the test. That is the theme of this year's World AIDS Day. And Dr. Surani joins us live to talk about advances in ending this disease and the stigma surrounding it. Dr. Surani, so good to see you and having you back in the studio. It's always good to see you, Dr. Surani. Thank you so much for being with us. So where are we in the fight for complete care?
Good morning, Barbie. Glad to be here. First thing is that, this is an important milestone. Almost, as you mentioned, more than 30 million people have died because of this illness. Why this illness is very near and dear? Because this came in when I was in the medical school, when I was starting my residency. The HIV and AIDS came in and we had no cure. Now, I think with the protease inhibitor and a lot of the therapies, we can put the HIV into suppression just like blood pressure and any other illnesses. The key factor is what we can do. We try to do is achieve the goal by 2030, no more AIDS. I don't think so we're reaching the goal because of the inequality. I think there's a lot of disparity. I think three things we need to remember. First of all, we need to educate the people. Second thing is prevention. And third thing is treatment. And all it boils down is to education and eliminating the disparity. And we can talk a lot about each of this topic.
Let's do that.
So one of the key thing is education is a key thing. If you look at different countries and disparity, if you look in Africa, if you look in Malaysia, the countries where the gay marriages are legal, they have much lower risk compared to the places where the gay marriages are not legal. There can be risk maybe 70 times higher versus 12 times higher. If you educate the women, if they're in the school, the data has shown clearly that the risk of getting AIDS with the sexual education is much lower than when you don't have it. So prevention is the key thing, and education plays a key component. Then you need to educate what things you can do to prevent getting AIDS, and education regarding which thing and which behavior cause increased risk of HIV and which method can prevent it. That is very important. And once you do that, then the diagnosis is important. So you need to make sure that the access is available and diagnosis is available. And we need to eliminate the stigma around it, because people, if they may be having a symptom, they don't want to go ahead and get HIV testing because they are positive. But we need to remove this stigma. Just like blood pressure and diabetes, we go to the doctor. If you have a symptom pertaining to that, if you have a fever, illness, chills, there's no harm in getting it checked, because if you get diagnosed early, you can treat that.
Achieving equity to end HIV, and that's what we're talking about today.
Absolutely, that's this year's theme.
That's it. Thank you so much, Dr. Surani, for being with us, and of course you can help. The Coastal Bend Wellness Foundation will be gathering this afternoon in recognition of World AIDS Day. That's right, you can take part. The community is invited to come to the nonprofit Southside offices on Holly at Staples and wear red for an aerial photo of the signature awareness ribbon. Participants will be creating the ribbon shape while observing a moment of remembrance for those who have lost their fight against AIDS-related illnesses. And that's taking place once again today at 12:30.